and welcome back to this episode of Family in Focus on PHLV Radio. Thank you so much for joining us on this Monday, the first day of February. I can't believe we're finally out of January. It's now the first day of February. So we are going to be talking about something that a lot of people have been thinking about, especially with this past year, dealing with a lot of health issues and health topics, including COVID-19, is getting health insurance. And the Asian Community Development Council, which presents this program and helps bring this program to you, definitely has been doing that to help people in the community, especially in bringing good information, especially about enrolling for health insurance. So today I have some special guests with me. I have Eddie Burkhart, who is the Director of Sales for Nevada for Friday Health Plan. So we're going to talk with him in a little bit, along with our Director of Family Services for ACDC, Vice Solano. So both of them will be joining me on the show today to talk about this topic of health insurance. We've been talking about open enrollment, which ended in Nevada on January 15th, but you actually can still enroll for special enrollment. So we're going to talk a little bit about that coming up. But first, we wanted to bring up Eddie, who is kind enough to join us this afternoon on this topic about health insurance, and actually a brand new health plan that is available here in Nevada, which is called Friday. So Eddie, thank you so much for joining me today.
Thank you so much for having me. It's great to be here.
Thank you so much. And so Friday, I honestly, I have actually never heard of this, but you said this is pretty new. First year you're offering this right here in Nevada.
That's correct. So first year for Nevada for this plan year 2021, but been in Colorado for past 45 years. So we're expanded to a few states, and this year we're excited to be in Nevada.
So tell us a little bit about Friday. There were so many health plans out there, as you know, when it comes to health insurance, it's kind of overwhelming for a lot of people. But you're saying that with Friday, you're keeping it pretty simple for people who are getting this plan, right?
Yes, absolutely. Anyone that's ever had to work with health insurance, it gets confusing with the different plans and the different things that you have to go through and how much you pay out of pocket and things like that. So we try to keep things very simple because it's confusing enough. We try to keep things very simple, limited number of plans that are offered, and just keep things very simple with the idea of for offering plans for those people who purchase their own insurance so they can fill the void that they have when they don't have insurance.
Awesome. So so it's offering right now Colorado, Texas, New Mexico, and Nevada, right? So are the different states that are being offered right now.
That's correct.
And so, for people looking to health insurance, are you offering this specifically targeting individuals or small businesses? Who are the people that you're working with right now?
Well, we work with individuals and small businesses since we just finished, as you mentioned, open enrollment through the Nevada Exchange, and going forward, we did do extremely well in the open enrollment period. So we do kind of target those people who purchase their own insurance. So we do have a lot of people that are individuals purchasing their own insurance. And when we look at going into markets like Nevada and so forth, we look at the demographics that are out there and the plans that are offered and make sure that we can fill a void where some people may have a need that's not being met at this point. So we just like to fill that void with our plans for those individuals. And we do things for small business as well.
Yeah, and I know you're offering this through the online health insurance marketplace, which is the Silver State Health Insurance Exchange here in Nevada. So what are you seeing here in Nevada that might be kind of unique? I know we have, a lot of small businesses here in Nevada, a lot of people freelancing. Are you seeing more of that population here, especially in the state of Nevada?
Absolutely. We do see a lot of freelancers, gig workers, and so forth that will fall into that exchange or individual marketplace. And so we do see a lot of that. And that's what our plans are geared towards, because there's many people that will purchase a plan and overbuy their benefits, where they're buying too much coverage from what they actually need. There might be a healthy individual and don't need as much coverage. So sometimes they overpurchase and they're spending more out of pocket on a monthly basis for that plan. So we try to offer something very simple for those people, those individuals that have that need.
Is that what you're seeing out there, especially you having been in the health insurance industry for many, many years? What are kind of the changes that you're seeing in terms of what people are looking for when it comes to health insurance, especially now, with COVID-19 becoming a big factor for a lot of us?
Well, I think that some of the things that's definitely evolved over time is consumers have gotten more savvy on purchasing their health insurance. They look for things that kind of fit their needs. Always in the past, prior to the Affordable Care Act, people would just purchase a plan if they wanted one or not. And it was fairly comprehensive in benefits, and they just really didn't really do much research into it. Now they're being more frugal in finding their purchasing decisions, especially now with COVID being out there. COVID is one of those things where always in the past where young people said, well, I'm young, I'm healthy, I don't need health insurance. But something like this affects everybody differently. Someone can be young and healthy and it affects them differently. So we're starting to see a lot more younger people start to purchase their health insurance and say, you know what, I want to be protected for this COVID pandemic and make sure that we have, that I have something that available to me so I don't have some sort of financial disaster if I do test positive and get very, very sick. So there's been a lot of changes in that over the, especially this year, we've seen a lot of activity with the enrollments with younger individuals as well.
And I think, we're in such this generation just kind of using to be on demand, right? They get to pick and choose what they want, and they don't want just kind of a general plan that maybe doesn't affect them or cover everything that they need.
Right. Absolutely. Absolutely. And there's some people that, they're very healthy. They don't, need a broad range of coverage. They need the essentials covered and low out of pocket on a monthly basis. So, and, they shop a little bit more wisely these days.
And, we were talking about COVID-19 earlier. Can you talk to us a little bit about what Friday offers when it comes to maybe, treatments or checkups or anything related to COVID-19 in particular?
Yeah, so any testing for COVID-19 is covered at 100% by Friday Health Plans, as well as the treatment for it is covered as well, but also the vaccination is covered as well, which is important as a vaccination is being rolled out and everyone's eager to get that, and that's covered as well. But I think, one of the things that's important to note too is that because of COVID, a lot of people are afraid not only to leave their house, but if they do have to go to the doctor, they're a little worried about going to the doctor. And because if you go someplace, they may come back with something they didn't go in with. Mm-hmm. And so some of the things that I think that are important that are offered, and we offer as well, is the teledoc services at a $0 copayment. So you can see a doctor through your phone, your laptop, or what have you, and see that visit, so you don't have to physically go in someplace and be around other people that are sick. As well as the mental health. The mental health during this pandemic has become a very important thing because we truly believe that your mental health is just as important as your physical health. And we offer that through Teledoc as well at a $0 copayment that you can speak with somebody as well. But even with urgent care, people, if they have some sort of urgent need to go to urgent care, we also offer urgent care visits where we contract with Dispatch to Health, where that's urgent care that comes to your home. So you don't have to worry about going into a facility and hoping and thinking that you will pick up something that you didn't go in with.
Right. And, that stood out to me seeing the mental health visits, especially on your website, because we just did an episode not too long ago talking about mental health and how, a lot of Asian Americans actually don't seek out help, as one of that population group that there's still a lot of stigma. So it's so important to have this kind of services and help that's out there in the community.
Absolutely.
Yeah. And, I think my concern, and I think, this is one for me, just thinking what's in network, what's out network, what's my access. And you said, telehealth. Do you and I think what's hard is sometimes people make an appointment, and I know with COVID and everything now, it takes forever in order to get a doctor, in order to get an appointment. Are you doing anything with your plan to kind of help making it more accessible, especially for people to get an appointment where they need to, and in network and that kind of thing?
Well, we do contract with Hometown Health Network. So they're a large statewide PPO network in Northern Nevada, as well as Southern Nevada. So, and they keep adding to their network as time goes on as well, with primary care physicians and so forth. Mm-hmm. And because of that, and a lot of the providers' offices too are saying that, I we don't want to see too many patients at this point. So we felt that that's where the need for the teledoc was very, very important. Not only on the physical health as well as mental health. That way people can be seen, and if they need to get a prescription written, they can, and they can go pick up the prescription and so forth. So, as I think, we can't control the provider's offices of how many patients they see and so forth and how they're opening it up. But I think as we offer different services that people can do from the comfort of their own home or dispatch to health and them coming to you, I think is going to be huge when it comes, when trying to get appointments and so forth.
Yeah, no, and thank you so much. And if people are just tuning in to Facebook right now on our PHLV radio, we're talking with Eddie Burkhart, who's the director of sales for Nevada for Friday Health. And this health plan is actually just brand new to Nevada this year for open enrollment, which actually just ended on January 15th. So, a lot of people were enrolling on Friday. And one person who's just kind of been through that process is Vice Solano, who is also on the program with us today. Vice is the director of family services for ACDC. I want to bring you on here. And Vice, tell me a little bit about your relationship in terms of working with these different health plans, including Friday, and what ACDC does.
So with the Health Navigator program, we collaborate with various insurance carriers, such as Friday Health Plan, which is one of the insurance carriers on Nevada Health Link. So with this program, we help individuals access affordable health insurance through Nevada Health Link, which is our state-based marketplace, where individuals can purchase federally regulated and also subsidized health insurance plans. So as you have mentioned, open enrollment period has ended January 15, but even if you have missed the open enrollment, you could still be eligible for a health insurance plan if you have a qualifying life event, such as you change your job, you got married or divorced or moving. And then we, with my team, the health navigators, we help determine if you are eligible, and we find the best plan in that fits your needs. So
yeah, and what's really great about, and we've talked about this before, but if people are kind of new to what ACDC does, is what's great about having your organization and a nonprofit helping out is to offer this help in different languages, right? Because not only is just finding health insurance kind of confusing, but when it comes to the language barrier, that can be an issue as well.
Yes, so the good thing about the Health Navigator program at the Asian Community Development Council is we have state licensed health navigator that speak different languages such as Tagalog, Vietnamese, Spanish. So, and even if you in need of a language assistance in terms of Mandarin, we can have one of our staff members help out in explaining to you what the health insurance plans are, what the coverage are, because how health insurance is very it's very confusing and difficult. So with our state licensed navigator, we can help you understand what copay is, deductible. So yes.
And what's great is, this service is free of charge. People don't get you working with you is they don't have to pay anything, right?
Yes, so there is no financial cost to the client if they need help, especially those who speak English as a second language. There it is free, and we help out with our in terms of our services in really finding and helping you choose the right plan and give you options in what will basically fit your medical and your budget needs.
So talk to me about how you're helping people right now, because as you know, with COVID-19, I know you've shifted your services a little bit. I know you just moved to a brand new office too at 8863 West Flamingo. And also we have our in Shanghai Plaza as well, right? In Chinatown on office there. So let people know, can you help them virtually, or do they have to come in, make an appointment? How does it work right now with ACDC?
Yeah, so since the pandemic, we have transitioned our way of doing things in terms of assisting clients in virtually. So everything is done online, and it's pretty much we show the Nevada Health Link portal, and through that it would be easier for us to communicate with the clients. And also, if there is a need for us to meet you, then we can still set up an appointment by going to our offices at Shanghai Plaza and also at the Flamingo office, which is at 8860 West Flamingo Road. But basically, all virtual um, communication platforms such as Zoom and even on Facebook, Messenger, we can do that. We even on Viber, so anything, or even via phone, we could definitely help the client.
Yeah, and I think that's what's nice. And we have some information on the screen for people right now. The phone number to contact Vice and her team at ACDC. So we'll put it below in the comment too. But I think right now people just, they want to get help and they want to get not just going to get to the doctor, but also, about health insurance. But as you just to press the point that even though open enrollment period for Nevada is over, people can still contact you for special enrollment if they have some, major things have changed in their lives, right? Whether it be, you said, divorces, getting married, having a baby, or they lose their jobs or something like that, they can still apply for health insurance that way.
Yes, that is true. And if you're, as you also mentioned, that if your income or your household changes, then you also have to update your application with income and the household changes. So with these changes, it can with a higher or lower income, or even if you're adding or losing a household member, then in that way you will get the best health coverage, because it affects the coverage in terms of your savings in which you are eligible for.
Yeah, and we are talking with Eddie, of course, with Friday, but there are many other health plans, and basically you're there. Your job is to give information about what's out there and available for people.
Yes. So through the Nevada Health Link, we provide options to the client. In we show them what is eligible, that they're eligible for in terms of their income and their household size, and through the marketplace, the different insurance carriers are available in there, in which the client can shop and compare different plans according to their needs.
That's right. And, bringing Eddie back into the conversation here, Eddie is kind of like, as you can say, new kids on the block when it comes to Nevada, right? As a health insurance carrier. How does it feel to be able to work with groups like ACDC in order to get the word out about what you do?
I think it's been amazing. I think the community has embraced us very, very well. Everyone's been so pleasant to work with. As I probably mentioned before, I have been in this industry for almost 30 years in Nevada. And I've always enjoyed working with different offices to get the word out there. And this has always been a passion of mine, not only my business, but a passion of mine to make sure that what we're doing is providing good, solid information and opportunities for members to enroll in the plan that best fits their needs. So it's been great working with everyone.
What's your advice? And, given you've been in this industry for so long, you've seen the shift and, different things that are being offered. What's your advice for people looking for health insurance, looking what their, whatever to fit their needs and their budget? What's kind of that message you want to get out to the community?
Well, I guess for me, it would probably, it doesn't matter what insurance company they choose. They need to choose one that best fits their needs. And, just like Vice had said about what she does for the community, what she does is very, very important because she is able to explain the different health plans and to find out what the needs of that member is to put them in the right plan. And to that's very important to us. And I definitely stress that to anyone looking for health care coverage to find a professional like Vice to help them through the process and finding out what their needs are, because she is an expert at this and she's certified to do this, to where it's going to be more advantageous going through her than them going on to search for it themselves. It's, for shopping for it. So that's probably the biggest piece of advice I can give to anybody, is definitely go through a professional to where they can help you through the process, because insurance is not a fun thing to deal with. It's not always interesting, but we all have to deal with it. And when you have a professional help you through it, it makes life so much easier.
Yeah. And, part of the reasons we have this show and we put this information out there is hopefully help to kind of make it less complicated for people, at least give people kind of the right place to go, whether it be to ACDC or go straight to Friday Health Plans. And I know, Eddie, you have a website where people can go get more information, right?
That's correct, at fridayhealthplans.com. You can go there and find out information, the plans that we offer, because we do have certain things that are kind of our niche, where we have our most popular plans have a $0 copayment for primary care visits. We have a $0 copayment for mental health. And this is in office or teledoc, so either way. And we also have a prescription drug plan where we have over 4,000 prescription drugs, generic drugs at a $0 copayment. So those are all things that are out there and on the website, and things that are kind of, our thing that we like to do for the different members that we put out there. So we have the website out there, and they can find out more information there as well.
All right. And Vice, I'll have you have the final word here. That is not too late to get health insurance, right? We have this thing called special enrollment here in Nevada that can make you still eligible to get health insurance.
Absolutely. So if you still need the health insurance, please reach out to the Asian Community Development Council, and one of our state licensed health navigators will help you enroll or change plan if you have certain life changes or you qualify for Medicaid or CHIP, and we will be able to assist you. So please call 702-489-8866 or 702-772-2568, or email us at info@acdcnv.org or healthcare@acdcnv.org, and we will assist you in finding the right coverage for you and your family.
Awesome. Thank you so much, Vice, and all that information up there on the screen. I'm going to capture that really quick. And if you want to pass this link on to your friends and family out there watching, that would really be helpful as well. All right. So it's starting off a new month on a good note, getting some good information out there. I want to thank my guest again, Eddie Burkhart with Nevada for Friday Health Plans, a brand new carrier here operating in the state of Nevada. Thank you so much, Eddie, for all the information that you're giving us today regarding health insurance, and also Vice Solano, who's the Director of Family Services with ACDC, who's always there to help. Her phone number is right there on the screen if you have any information, and she can speak Tagalog. So if you want help in Tagalog, she can do that as well, right, Vice?
Opo. So sa aking mga kababayan, kung kailangan nyo ng health insurance at naghahanap kayo ng coverage para sa iyo at iyong pamilya, tumawag lamang sa aming numero na 702-489-66, o kaya mag-email kayo sa healthcare@acdcnv.org, at nandito kami para tulungan kayo sa paghahanap ng health insurance para may peace of mind kayo sa taon na ito. Salamat.
All right. Thank you so much, Vice, for helping us out today, and also to you, Eddie. Have a great day. And thank you so much for watching, everybody. We'll be back next week at noon on Family in Focus right here on PHLV Radio. Have a great day.